You're going to like this note because it's very, very easy. Today we're going to talk about vital signs. So we're just going to get started with this. So our first vital sign we're going to look at is the heart rate, also known as the pulse. Remember, a normal adult pulse is going to be 60 to 100 beats per minute. So the BPM stands for beats per minute. This is going to be greater for babies and children. So if you're, ever around a little baby, and you get a chance to hear their little hearts beating so fast, it is actually pretty cool to hear. And then we can describe how the heart rate sounds or the pulse feels, all right? So is it regular? Is it irregular? Can you find it really easily? Is it a nice strong pulse? Or is it really weak and feebly and spindly and you can't get a really good reading of it? So you've probably done this. I know we do it in grade 10 a lot of times. We look at the heart rate. I know in grade 11 we use the stethoscopes and you take a peek at it. I know they do that in healthcare as well. So basically our technology for finding our heart rate is using our fingers and finding a pulse somewhere to find the pulse, and you count the number of beats per 20 seconds, or you can do it up to 1 minute. Some people do it for 10 seconds, whatever it is, just multiply it by the correct number to bring it up to a minute. So if you're doing 20 seconds, multiply the number of beats that you feel by 3 to get it to your beats per minute. If you're counting for 30 seconds, multiply it by 2. If you're counting it by 10 seconds, multiply it by 6. It's usually better to do it longer rather than shorter. So 20 seconds, and I know in healthcare we teach you to kind of do it a couple times if you're not too sure the first time, to do the pulse a couple of times just to double check. And if you're only counting for 20 seconds, it's not like it's going to take very long. We're going to use a stethoscope also if we want to, so you could listen to the actual heart and count that. And we know we've already talked about the expense of a stethoscope, which is $100 or more. So here you can either use this technology, is very cheap. It'll cost you nothing because you're using your own fingers, or you're just going to use a stethoscope. So where can the pulse be felt? Well, anywhere that you can have an artery that can be compressed. So anywhere you can get to, it's going to be the artery that we're going to be feeling here, because that's one that's going to get the pulse out of that left side of the heart. So anywhere you can compress an artery. So you've got that one in your neck, the carotid artery. There's one in your underarm that you can feel. Sometimes you have to really dig for this one though, especially if you're a little bit meatier. The brachial one, so this is the one that'll be used with the blood pressure cuff that they use. That's the one that's just above the forearm there. The radial one, this is the one that you see that we use a lot of times, the one that's next to the radius. All right, sorry, there was a dog barking. It was distracting me. The femoral one, so this is just in your groin. The popliteal one, this is the one that's on the back of your knee. Posterior tibialis, so this is one that's kind of in your ankle, and the dorsal pediis one, so in your foot. All right, so anywhere you can get a pulse, you can do the pulse reading. The next vital sign we're going to look at is blood pressure. So remember, blood pressure is measuring the pressure of the blood on the artery. So we're trying to see how much force is the blood coming out of the heart and onto the arteries. That's what we're measuring. So this measures the pressure of the blood on the arteries. Now the systole number, this is the number or the pressure that's going to be on the arteries when the ventricles are contracting. So this is the high pressure part. So when the ventricles are contracting, so either the right ventricle or the left, well, they're both contracting at the same time. So this is when that left ventricle is pushing the blood out to the body. We're going to measure how much pressure are on those arteries as that blood is pushing out. That's the systole number. So that's generally going to be a little bit of a higher number than the diastole, and this is going to be the pressure on the arteries when the ventricles are, we say, relaxing, but you know it's your heart, so it never really relaxes. This is when it's filling with blood. So this should be a lower number because hopefully there's not, a whole lot of pressure on the arteries when there is no blood being pushed out into it. So let's look at some of the numbers for our blood pressure. So what we would like is the number on top, the systolic pressure, so the pressure as the ventricles are pushing the blood out into the arteries, we would like that to be between 90 and 140 millimeters of mercury. Now, the millimeters of mercury is from an old sort of measuring system where the pressure actually pushed a column of mercury up a number of millimeters. We don't use that. We don't use those anymore because mercury is not the greatest thing. And the number on the bottom should be between 60 to 90 millimeters of mercury. You don't want it too high because this is when the heart is supposedly resting, right? So normal blood pressure would be around 120 over 80, and that's going to differ on different types of people. Now, if your numbers are of this, so between 120 over 80 to 139 over 89, you're considered to be pre-hypertensive. So this is kind of like a little warning sign saying, you know what, it's time to get your life in order. Maybe lose some weight, maybe get some more exercise, maybe cut down on your stress, maybe start making sure you get enough sleep, maybe reduce, late night partying or kind of stuff. It's kind of like your pre-warn. It's a warning to give you an idea that, bad things are coming up in the future. For some people, if they do have genetic hypertension, maybe this is a time where you work with your doctor to get on some medication to start bringing it down before it gets really, really high. Or you can also do lifestyle changes to try to bring it down. Hypertension is considered to be anything that's over 140 over 90. So that's a lot of pressure pushing on those arteries. Now, conversely, we have hypotension. Most women have low blood pressure. So for women, it's considered if your blood pressure is under 100 over 60. And for men, if it's 110 over 70. So, you want your blood pressure to be low. There's a point where it starts to get too low and it can cause a problem. What is the causes of hypertension, or what are the causes of hypertension? Well, there's a whole bunch of them. All right, so let's go through some of the reasons. And again, sometimes it's just genetic. It runs in families. So you want to make sure that your lifestyle doesn't promote anything worse than what you're born with. Right? We can't completely reverse our genetics, but we don't have to give our genetics a free rein. Obesity, there it goes again. So if it's a genetic thing that runs in your family and you're overweight, it's really important to keep your weight in check. Ethnic background, there are certain ethnic backgrounds that tend to have a higher blood pressure than other ethnic backgrounds. If you don't get physical activity, so if you're the kind of person who sits around all day long, you don't do too much walking or too much, of any type of exercise, your blood pressure can tend to go up as well. You can be skinny and still have high blood pressure. Excessive alcohol use, a whole pile of stress. So if you have a really, really stressful lifestyle, and unfortunately, sometimes with people with stressful lifestyles, well, they treat their stress with alcohol, they eat crappy, right? They probably don't have time to exercise because they're like, oh my God, I don't have time to exercise. My life is so stressful. So, people don't manage their stress. If you have kidney disease, if you have diabetes, so again, there's another condition, and sometimes you can have type 2 diabetes that sometimes is caused by obesity, or you can have the genetic diabetes. So it's really important to make sure you keep your diabetes under control because you don't want to have your diabetes out of control and have hypertension. And sleep apnea. So sleep apnea is a condition that happens where people stop breathing during the night. There may be a blockage in the back of their throat due to, again, being, severely overweight and you have a lot of fat deposits on your back. It also happens with age. It's also a genetic thing as well. So you literally stop sleeping for a few minutes at night. Now, if you see this part of the word here, the PNE8, that talks about air and breathing, and this A without. So this is sleep without breathing. And high salt intake. Now, there's a whole bunch of studies that are out. In the olden days, they said, oh my God, a high salt diet's terrible for your high blood pressure. Well, it is a problem for people with high blood pressure. They do have to be careful with their salt intake. But a normal person that kind of has a regular, you exercise, you're not overweight, you control your stress, you're not a big boozy, partier, you don't have genetic hypertension, you can have salt in your diet. There was a time where people were having no salt at all. At the hospital right now, if you're a patient in the hospital and you try to get food or they give you food, there's like 0 salt in their food because they put everybody on a low salt diet, right? But generally, salt as long as you're not pouring containers of it on your food, you're fine. As long as you're not eating fast food every day or processed food every day that's really, really high in salt, you can have some salt. Don't be afraid of salt. Just be aware. Alrighty. What are some of the problems with hypertension? Any of you ever do any gardening and you have a crappy garden hose that's got bulges in it, and you turn the hose up really, really hot? It happens at our house all the time. And then next thing you know, bulge explodes. Well, this is the kind of thing you do not want to happen to your arteries. So you can end up with a heart attack. So remember, heart attack is just basically when your heart doesn't have oxygen going to certain parts. So maybe the blood pressure is too high and you've dislodged a clot, or you formed a clot and you've cut off parts of blood to your blood system, okay, or to your circulatory system or your heart. A stroke, so again, we talked about the stroke being in the brain. You dislodge a clot, it gets pushed through with the high blood pressure into the brain. We have an ischemic stroke where there's no oxygen, or you get that big pooling buildup of blood behind the clot, and then you end up with a hemorrhage. You can end up with an enlarged heart because the heart is trying to compensate, like it is a muscle, so it's trying to push out more blood at a higher pressure, so it starts to get bigger. And you might think, well, it's really great having a large heart. It's really not. It can also cause kidney disease. Even though kidney disease may be a problem of hypertension, hypertension may in turn cause kidney disease. You can end up with vision loss because a lot of those capillaries that feed your eye end up breaking because of the high blood pressure. Angina, so again, you're going to have that heart pain. And another one we're not really going to get into is peripheral artery disease. I don't do peripheral artery disease with you guys because sometimes people do that as a project, and I just like to leave it because we do coronary artery disease, but it's basically the same thing as coronary artery disease. It's just in your arteries outside of your heart. So you've got the hardening of the arteries and you've got blood clotting and all that kind of stuff out there. So what are some of the causes of hypotension? So besides that you're just naturally like a good athlete, or you're a female, what can cause your blood pressure to be lower than normal? Right? You can be pregnant. So a lot of times when you end up with being pregnant, your blood pressure goes really, really low. Hypothyroidism, so your thyroid is working below what it should be. So that can cause your blood pressure to fall. Different types of medications. So if you have if you're getting medications for high blood pressure, all right, they'll adjust medications when you're first on medication. A lot of times they need to adjust them. So sometimes they'll give you medication for high blood pressure and then it works too well and it causes you to have low blood pressure. Some medications for depression and some medications for Parkinson's can also cause low blood pressure. Heat exhaustion can cause low blood pressure. Liver disease. Another one also that causes low blood pressure, which I didn't put on here, but is if you're very, very sick with a really a high fever, or you've gone into sepsis or something like that, it can really cause your blood pressure to fall as well. Right? It can also cause your blood pressure to go up as well. So what are the problems with this? Well, this is the kind of thing where you're dizzy. If you've ever stood up really fast, you kind of get that dizzy feeling. That's what it feels like to have hypotension, but you would have this basically all the time, right? When you get up really quickly, the blood has pooled in the lower regions of your body, and your body just takes a little wee second there to try to pump it up to your brain. But with chronic hypotension, it happens all the time, right? You get weakness because you're just not, pumping the blood to your muscles. You can end up fainting because, and I know sometimes you actually feel like that when you stand up really quick, you're like, oh my God, I'm so dizzy, and you almost feel like you're going to faint. Well, you literally will faint if you've got really low blood pressure. And part of the problems with that if you're fainting is you're falling all over the place, right? So you have a risk of injuries from those falls because you're fainting and you're just dropping wherever you're at. And you can also end up with some damage to your heart and your brain from low oxygen levels because your blood just isn't getting pumped to those important parts. All right, so how are we going to measure our blood pressure? So our technology for measuring our blood pressure will be a Sphygmomanometer. Most of the time we just call them blood pressure cuffs because it's so much easier. Sphygmomanometers, and I think some of you probably used in grade 10, grade 11 biology. I definitely used them in healthcare. grade 11 biology. I know I did them with my class. So we can have the manual ones, and a lot of times, I think I said this earlier, a lot of times the manual ones are a lot more accurate than the electronic ones, just because the electronic ones tend to just have more things that can go wrong with them. All right, so you would use this with a stethoscope. Unfortunately, we won't be able to do this in class, but we would spend a day just, kind of learning how to use this equipment. But you're going to have the stethoscope on that brachial artery, and you're going to be listening for the heart beating. It's actually kind of cool because when you're looking at the little dial that's here, you can actually see the heart beating as the dial goes down. It's really kind of fun, right? And these can range from $40 to $400, and even more expensive if you get the ones that sit on the wall in the doctor's offices. But again, fairly cheap technology that's going to give you a whole pile of information about the health of your patient. And then we have the electronic ones. Now you've seen the electronic ones we have at school, which are pretty, they say right on them, not to be used for actual, medical analysis, but still they work quite well, except when they don't, because they've been hit with students hitting them all the time, constantly. But these ones range from $40. So the ones we get are $40, $50, and they can range up to $1,000. They're really fancy ones in the hospital. All right, so another vital sign that we're going to look at is the respiratory rate. And if you remember this one, this is the one that you look at. Well, you don't look at the patient, like, obviously, but as you're doing their pulse, you kind of count how they're breathing at the same time as they think that you're doing their pulse, because as soon as people know that you're watching their breathing, they do adjust their breathing. It's kind of a weird thing. Even if you say you're not going to adjust your breathing, you'll find that you do kind of adjust your breathing. So for our normal respiratory rate, our normal eupnea, we would like it to be around 12 to 18 breaths per minute. So that would be around normal. Okay, somebody who's just normal. Okay, again, the number is going to vary depending on the person. Somebody who's like a really superb athlete, I'm sure, is not gasping in breaths as much as just a regular person. Bradypnea, I actually made sure I went to a pronunciation thing to say this. So bradypnea. So Brady, same thing as our Brady, meaning slower. For our heart rate, for our breathing rate, bradypnea is if it's under 12 beats per minute, and tachypnea is if it's over 18 beats per minute. All right. So we would also like to be able to describe, now again, with conditions for these, we can have injury, we can have illness. So if you've got a fever, a lot of times you're going to be breathing a lot faster. We can be, your patient could be taking some type of drug that slows their breathing down. All sorts of reasons why you'd be breathing higher or lower. They may be really, really sick. So if they've got a lung congestion, they may be trying to breathe faster to try to get oxygen in. Their body's telling them not enough oxygen, so they're breathing faster, even though they've got pneumonia or whatever it is, so they can't get that oxygen through. So we would say some of the descriptions, we could say, well, they're breathing normally, or they're breathing shallow, so they have that really like quick, shallow kind of breathing, or they have labored breathing where they're like dragging the air in. As soon as I do that, I'm going to cough, and then like trying to get it out. It can be really noisy, so you can hear like crackles and mucus and all sorts of stuff. So if you were ever phoning in a 911 call or describing breathing to in a history, sorry about that, you may describe how the breathing sounds as well. Okay, and this is what I was saying, measuring it by sight. So you want to just kind of watch the chest raises and lowers, so that the patient doesn't raise their or change their breathing pattern, and you kind of watch how many times they breathe in and out, 20 seconds, 30 seconds, a minute, and you just watch them breathe. Just watch them breathe. Just count the number of breaths per minute. All right. Last one that we're going to talk about here is body temperature. So normal body temperature is around 36.5 to 37.5. Now I was listening to this science podcast the other day, and they were looking at because when they were first doing, it was quite interesting. I was like, oh God, let's see what this podcast is about. It's going to be really good. They were looking at the equipment that were used in the olden days, and they were re-measuring people's temperatures using that old equipment. And they found that the equipment was still pretty accurate. It was off a little bit. And people were measuring a little bit lower, so then they got like the fanciest equipment they could find, and they measured all sorts of people. And they found on average that people's body temperature is falling, is a little bit below. But the new like they didn't make any new guidelines of it because there was no point to it. Like if you're down, if normal human body temperature is down by half a degree, who cares? It's not that big of a deal. Okay, so it was just kind of an interesting thing, and they were like, is the body temperature going down because we're adjusting to global warming? Is normal body temperature a little bit lower because we live in houses now, not out in the, we have heating, and we can heat our houses up in the winter time. But anyway, so the guidelines still say a fever is anything that's over 37.5. You'd be really, really amazed at how, if a kind of a neat experiment, if you ever want to try it, is to take your body temperature, same time every day for a month, and you'll be surprised at how you stay within a range. Depending on, for females especially, the time of the month, your temperature may vary a little bit, and your temperature will vary during the day. It's generally a little bit lower in the morning and then higher in the evening, but generally it'll stay within a range. It's pretty darn amazing. Okay, so a fever is anything over 37.5 considered. You're hypothermic if your body temperature is below 35 degrees Celsius. And remember, the problem with hypothermia, you may think, well, what's the big deal? You're a little bit cold, but this is inner core temperature. And remember those enzymes, the things that run all your body processes have to be at a certain temperature to run properly. So we want our body to be running at the proper temperature. Alrighty, so what technology are we going to use? Dum dum dum, the thermometer. And these, all sorts of thermometers in the world, all right? They can vary in price from $15 to $250. Usually you're pretty good at just getting a regular, like a nice good electronic one for home is fine. Because like I said again, once you can basically, if you have kids or even your own self, if you have kids that have a fever, you can tell they've got glassy eyes, they radiate heat. And if you've ever had a fever yourself, you know how you just get like a massive, massive headache. You just feel hot, and then you feel like really chilly. You just feel like crap, and you kind of have that red flush to your face. So, you don't need to go out and buy the most expensive thermometer that there is. Just get a good digital thermometer at home. Now, they can vary in accuracy. Oh, well, they can vary in accuracy as well. Thermometers themselves may vary in accuracy. So if you're going to do the underarm temperature, which is what we always did with our kids, because there was no way I was trying to put a thermometer in their mouths or use a rectal thermometer on them. So we just always held the thermometer under their underarms, just kind of hugged them. And we always kind of knew, like, if the thermometer said 37, then we knew their real temperature was 38 and had a fever, even though we could tell because the kid was like a little blast furnace of heat. So here's just a fairly decent priced digital thermometer. Just wait till it beeps, put on the underarms, or, if you're an older kid or you're doing it to yourself, you can do it under your tongue and then just wait till it beeps again and then done. Now, these are the ear ones. Now, the ear ones are, you think, oh, it's really great. I'll just pop that in my kid's ear. Well, they're not so cool, because if you don't put it in the ear properly, you will get a normal reading. So I know one of the times I was in the hospital 50 zillion times a few years ago, and I knew I had a raging fever. I could tell I had a raging fever. I didn't even need to know. I knew as soon as I had a fever, I was sick for a bit. I knew for sure as soon as my fever started. And I'd go to the hospital, and sometimes they'd use the ear one, and they're like, nope, yep, your body temperature is normal. And I was like, I was sitting there on fire, and they're telling me I had normal temperature. So you do have to be really careful with those ear ones, use them properly. Sometimes they have these strips you can put on the kid's head, which is, convenient again, because you're not fighting with the kid. But again, you can tell a kid's got a fever, so it's going to come up. It's like those things you have in your fish tanks. I'll tell you the temperature in your fish tanks. So, if it turns green, you'll know your kid has a, sort of like a low grade fever. If it's red, a little bit higher, and then 40, who better get that kid to the hospital, kind of a thing. And then we also have those thermometers that the laser ones, the infrared ones that we use, or I don't think they're laser, they're infrared ones, that if we were in class, I would go to Miss Henschel and borrow one. The other thing I was just going to say about thermometers as well is, oh, doggone it. I can't remember. I'll remember as soon as I finish this show. Oh, darn. It doesn't matter. Anyway, so here's the one that you can just kind of like shine it at the kid's, forehead or your own forehead or whatever and get the temperature. But again, this is what you'll see this. Actually, it's funny. Why am I even talking about this? This is the one you see, that they're screening all the people to see if they have a fever when they arrive at the airports or, they're driving around in cities and stuff. I haven't really seen this so much in Canada, but when you see all the um, news footage from China or Europe, you'll see people at the airports going beep, beep, along because it's a lot quicker than doing it this way. All right, I can't remember one of the things I was going to say about thermometers. So what I'm going to do is that's the note. I'm going to put an organization chart as well, which I would make you do in class and then hand in. I'm not going to have you hand it in. If you want to complete it just so that it kind of makes a nice comparison of what you're looking for these 4 vital signs, that would be great for your own learning, but it's not going to be important for you to hand in. And of course, there's going to be a quiz, which is probably going to be very easy because this stuff is pretty easy. Alrighty, that's it for now. Hey, I actually remembered this was the end of the whole thing before I just changed it and cut myself off.